Although patients do not receive an actual marijuana card, as in most states, patients in Texas suffering from a list of qualifying medical conditions may be eligible for a medical cannabis prescription. Keep watching to find out more. Requirements. In order to qualify for access to medical marijuana in Texas, a patient must be a permanent resident. Furthermore, the patient must be diagnosed with a qualifying medical condition and seen by a certified Texas medical marijuana doctor. Patients under 18 may also be eligible for a medical cannabis certificate. However, in the case of minors, a second qualified physician must concur with the prescribed treatment. A parent or guardian of a minor must act as a caregiver to purchase and administer the medicine, and he or she will be required to show proof of identification. Appointments. To get started, patients must find a Texas medical marijuana doctor. Before making an appointment, be sure to tell the physician's staff about the patient's condition to assure that the doctor is the right specialist and that the patient's condition qualifies. The doctor's staff can help the patient gather all the necessary medical records required for the initial examination. If the patient is approved, their Texas cannabis doctor will enter their information into the Compassionate Use Registry. The patient will then be able to purchase medical marijuana products. To find a physician, patients can use the list of medical marijuana doctors in Texas on our page, or you can use the inquiry form on this page and an appropriate practice will respond. Telemedicine and telehealth appointments. The state of Texas permits qualified patients to confer with their doctor using MedCard telemedicine from the comfort of their home for both initial examinations and follow-up appointments. Telemedicine is the practice of consulting with a doctor via telephone, tablet, PC, or other means of a teleconference. The term telehealth, on the other hand, is reserved for consultations with healthcare providers who are not licensed physicians or their agents. However, the state differentiates between the terms telemedicine and telehealth. Furthermore, medical records, including documents like scans, x-rays, lab results, etc., can be transmitted via the internet. Not all medical marijuana doctors in Texas offer telemedicine to patients seeking a cannabis prescription. Patients need to contact a medical marijuana doctor with whom they would like to consult to determine if they offer telemedicine appointments in their practice. Follow-up appointments. Frequent follow-up appointments are required for medical marijuana patients. According to Compassionate Telemedicine, follow-up appointments are required every 2 to 4 months. Cost. Fees for initial appointments range from $150 to $250 depending on the healthcare provider and their specialty. Follow-up appointments range from $100 to $150. Qualifying medical conditions. The Texas Compassionate Use Act initially listed only intractable epilepsy as a qualifying condition. The program was later expanded to include terminal cancer, seizure disorders, MS, ALS, Alzheimer's, chronic traumatic encephalopathy, and Parkinson's disease. And under the most recent expansion of the Texas Compassionate Use Program, PTSD and non-terminal cancer cases were added. Additionally, a qualified medical marijuana doctor must determine the patient's condition has not been responding to traditional treatments. The physician must determine that the risk of the medical use of low-THC cannabis by the patient is reasonable in light of the potential benefit for the patient. A second qualified physician must concur with the first physician's determination. For more information about medical marijuana prescriptions in Texas, visit our site today. And if you enjoyed this video, be sure to like, comment, and subscribe.